Hello everyone, welcome to Pediatrics by Dr. Anand. A beautiful day today. So we have a 7-year-old child. A 7-year-old child came with complaints of fever since 7 days and rashes all over the body. If you can appreciate, these all big rashes are there since 5 days. And on further examination, patient also had rashes and edema on the mouth and the lips, and also in the blood reports the patient had features of hepatitis. So now what do you think about this case? What is your best possible diagnosis? So point number one, I have told you this patient having fever with rash with one organ like liver involvement. Like this story can happen in so many conditions. There are so many differential diagnoses. But one special point I want to tell you right now is that the patient had these all rashes after starting. Like the story was, like 1 month back this patient had got a fracture. This patient had fell down from the first floor, went to the hospital. It was a frontal fracture, and they had started anti-epileptic. They had started phenytoin for this baby. This is 1 month back. The baby got a fracture, they started phenytoin, and because fracture was there, and they had to start anti-epileptic, and the baby was fine, fracture was fine. But after starting this phenytoin, then the baby got this problem of fever with rash with this liver involvement. So what is this? The best answer for this question becomes drug hypersensitivity syndrome. It's a case of DRESS, dress. That is nothing but drug reaction with eosinophilia with systemic symptoms, known as DRESS, dress. So exam entrance question number one, how the story starts. Point number one, like the proper exposure to medication was there, and then all the symptoms came. Number one. Number two, question number two, what are the drugs like what all drugs can cause this dress? So phenytoin can cause this, carbamazepine, phenobarbital, multiple drugs can have this problem. Okay, what are the signs and symptoms? The first, the patient will have fever and malaise, which my patient had, and also the patient had rash. Rash could be a small rash, could be edematous, could be erythematous. So multiple forms can be there. Could be vesicular, could be bullous, and mucous membrane also can be involved. It was involved in my patient, and patient had kind of cervical lymphadenopathy and facial edema. One more question is there. This is the exam question. Which is the most common extracutaneous site of involvement? If someone having a fever with rash with drug exposure, which is the most common extracutaneous other than the skin involvement in this case? So liver is the most common organ involved in such cases, and the patient can have features of hepatitis. Okay, that is one thing. Now last question, how to make a diagnosis for this condition? Obviously, number one, the patient will have fever with severe rash with facial edema with lymphadenopathy, but history of ingestion of some drug, and that's what the patient had. Okay, and if you do a CBC, complete blood test, you will get a atypical lymphocytosis with eosinophilia, slightly liver transaminases like liver enzymes will be elevated. Number one. And lastly, what is the treatment? The treatment, number one, of course, whatever the offending drug, the anti-epileptic is there, you stop it. Number one. Number two, and that also in our hospital, like what we did, we had to stop the phenytoin. But of course, you can't just stop anti-epileptic. But we started leveracetam, like other anti-epileptic, which has less anti-epileptic, like less kind of these drug or side effects properties. So we had to start levera, and we had stopped this drug. Secondly, steroids. We got a derma opinion also. They also said is we have to start a tablet prednisolone at the rate of 1 to 2 mg per kg per day, followed by you taper the drugs, and antihistaminics and topical corticosteroids for symptomatic management. That's all about this condition. For more such updates, you can join our WhatsApp group on 9999897081, and that's what. Thank you so much, everyone. Life is beautiful. Another beautiful learning case. I hope you learned something. So this was a case of dress, okay, and DRESS. The full form is drug reaction with eosinophilia and systemic symptoms. SS is systemic symptoms. Drug reaction, dress. Okay, this is important. Please take care. Thank you, and have a nice day.